You will laugh. You will love it. Sit back and relax. This is the Whatchamacallit Show.
Please welcome the one and only Payson.
Hello, everybody! Once again, welcome back to the Whatchamacallit Show. This is the second time we use this room. I think things kind of went pretty well using this room. It's not that bad, but something to get used for the foreseeable future. So I feel like life's been pretty good, especially with interviewing people about jobs and what they do. Like, it's perfect to be able to interview people like that. It's excellent because you get to find out about their careers. Another thing is that you get to see people from our channel, and you get to hear about some of their personal life as well. Some might be a little ashamedly bad, but it doesn't really matter. We're just doing an interview. That's all we have to focus on. We just have to have y'all experience the good stuff of our channel. So we're gonna go off with our interview for the day. So this person is a nurse. So just saying that we have a lot of nurses out there, and we appreciate all your hard work with all the people, especially the COVID patients. So I just want to bring that up. So this nurse has been a really great family member to us, and we have her today as our interviewee for the day. So please welcome Nurse Julie. How are you?
I'm good. How are you, Casey?
Great as always. Ready to do what I have to do, but then rest afterwards because of all the work. So on my records, it say this that you
introduce me.
Oh yeah. I was about to say on my records.
Okay.
It says that you are Nurse Julie.
Yes, my name is Julie, and I am a nurse.
How long have you been working in this profession?
7.5 years.
Because you started working as a dog, whatever.
Right. So I was a teacher for 3 years. So my original degree is in teaching, and then I went back and got a degree in animal veterinary technology, and then I was a nurse for dogs and cats for 12 years, and then I went back to school and became a human nurse, and I've been doing that for 7.5 years.
Great to hear. So,
Yeah.
What are your experiences as a nurse?
As a nurse, my first, I started out in the ICU, which is the intensive care unit. So it was a pretty difficult transition to go from animals to humans because it's just a lot more involved. And so I was in the ICU, so it was a pretty stressful environment. I took care of patients that had heart attacks and needed open heart surgery, and then patients that had liver failure or different kinds of issues that caused them to be in intensive care. And now I work in the PACU, which is the post-anesthesia care unit, and that is where people wake up from surgery. So lots of different experiences because everybody wakes up different.
So do some of them are scared of you?
Some people wake up very aggressive.
Yep.
And so they're like throwing punches, and of course they're still affected by the anesthesia.
That's
so
right.
they don't remember what you're saying, or they can't really hear you, or they don't know exactly what's going on. And so they're just, all over the place. And you just have to wait for the anesthesia to get out of their system. And then they're always like, "Oh, I'm so sorry. I'm not like that at all."
I remember you talking about that in conversations from our family.
Yes. Had lots of patients, almost gotten hit a couple of times. Yeah.
Anyway, so I have 10 questions I'm going to ask you, and you have to answer them the best you can. So,
Okay.
Have you ever needed to step up as a leader?
I feel like nursing is a position where you have to be a leader because you are responsible for that patient's or a group of patients' care for that day. So you have to step up as leaders. Our group or our unit has a charge nurse, and so that person is in a leadership role where they're making sure that all the nurses are adequately staffed and they are getting everything done that they need to get done, and they're there to help them if they need assistance. It's definitely a leadership role.
All right, makes a lot of sense. Wish I was one. I don't even feel like one.
Yeah.
No matter what I do.
A leader or a nurse?
A leader
A
in
leader.
general. Because I
Yeah.
feel like I'm not the best out of everybody.
Right.
But
I don't think
I don't
being a
need.
leader,
I don't need to be the best.
Yeah. I don't think being a leader means you have to be the best. I think being a leader means that you have to be able to see the entire situation and guide people in directions that they might need to go, or lend advice and kind of organize.
Yeah, perfect. All right. So the next question is, what was the biggest challenge you faced when working with a team?
The biggest challenge I faced when working with a team?
Yep.
So probably the biggest challenge I face now is working with nurses that I either don't get along with really well, or I don't feel like their judgment in the interventions that they do for their patients is the best thing to do, or I don't agree with how they go about their nursing process. That's the most difficult thing. Because I'm not taking care of their patients, I'm taking care of my patients. So,
Right.
and there's a bunch of different ways to do things, but in the end, she takes care of her patients and they get better. So, but it's just when you don't get along with somebody, that makes it difficult.
Yeah.
Yeah.
Okay, so have you ever worked with a patient who struggled with pain management?
Yes. So, because I work in a post-anesthesia unit where people have had surgery, usually when you have surgery, you're having somebody cut on you. So the patients wake up in pain. I would say half of them do pretty well with pain. We use narcotic pain medications, usually give them IV. But patients that already have pain issues, like if they're in chronic pain at home, if they've got back issues, or already have pain management issues where they're seeing a doctor for pain management, or they're overusing home medications that are for pain, like if they've gotten a prescription for their knee and they've been using it a lot, or they take a lot of pain medicine at home, then they're going to have a higher tolerance. And so it's almost like I can't help them because I can't give them enough that'll get them past that tolerance. So we just have to try to get it better controlled. But
Right.
sometimes we have to admit patients to the hospital so they can continue to get IV pain medicine.
Yeah, so the next question is, how do you handle questions from a patient's family and friends?
So I have to answer lots of questions usually because I'm discharging patients, and so the patients have had anesthesia and they don't really, they're with it, but they're not going to remember anything. So I answer lots of questions about the surgery that was performed, the home care that needs to occur when the patient gets home, what they can expect, and you always have to treat them with respect, family members, or treat them how you would want, to be treated if that were your family member that had surgery, or your family member that was in the ICU. They are our clients. You don't think of nursing and medicine as a business, but most of the decisions, insurance is involved, and so we have to make them happy, so we have to keep the patients happy and their family members happy so that they feel like they had a good experience, so the next time they're coming back to our hospital.
Yeah. Okay, so the next question is, how do you explain healthcare situations without using too much medical jargon?
Healthcare situations?
Yep.
Like, give me an example.
It just says, how do you explain healthcare situations without using too much medical jargon?
Jargon. I got a lot of medical jargon.
Like what?
Well, I don't want to. Okay, so one healthcare situation. So I'll give you a scenario of a patient that I take care of. So we have a huge vascular team and surgeons that only work on blood vessels, whether they're arteries or veins. And one of a very common thing that happens to people when they're not taking care of themselves is they can get occlusions or blockages in their veins or arteries. So a lot of time these people come in and they have to have their arteries cleaned out, or they have to have a bypass which connects an artery, to an artery lower in the leg. And so the doctors have to put them under anesthesia to do that. Then they have a long recovery time. We try to make sure that they're taking better care of themselves, and if they have diabetes, their diabetes is under control. If they have high blood pressure, that they're taking their medicines. So it's kind of a situation of the type of surgeries we have.
Yep.
And the hardest thing is that the doctors don't place their orders. We can't do anything without the doctor's orders. So if the doctors are slow at putting their orders in, then we're slow at giving the medications, because we can't do it without the order, because we can't prescribe medications or we can't prescribe treatments. So patients always get upset because it takes too long. Well, it's the doctor's fault.
All right, let's get to the next one because of all the conversations we've been having. But
Okay,
what do you do when you don't know the answer to something? So it could be like a answer to what a patient has or whatever.
Yep. When I don't have the answer, we do work in a team, so I can ask my fellow coworkers, can ask the charge nurse, if we can't come up with something, then we can call the doctors, and just kind of escalate from there to try to get the best answer we can. Or look it up on the internet.
Yeah.
That's what everybody does.
All right. How do you handle changes to your work environment, like a new system or upcoming schedule?
Healthcare is always changing, so we are actually getting a new computer software next year. So that's going to be a difficult transition. But I think that in any type of change in your environment, you just have to try to stay calm. You have to try to stay open, and not be too hard on yourself if you're having trouble learning the new system. But I think you just have to view it with an open mind and know that you're going to make mistakes, and there's a learning curve to it.
Yeah. Well, I feel like I'm getting a little interrupted by the speeches going on behind us, but we just have to get through those last 3 questions and then we can move on to our game.
Oh, okay.
During a shift, how do you manage your time to ensure quality patient care?
I always used a schedule grid for my patients, and I would, mark down different times that their medications were due, so that I could stay ahead of it and know which patient I had to go to. Of course, you always have to look for new orders, but I used we called it a brain sheet, which had the times. It was like kind of like a planner. It was broken up into the hours, and I would put things that needed to be done in those specific hours and try to plan out my day, so I could just use that as a cheat sheet.
Yeah, noticed seeing a flicker after that last question I answered you. So let's go ahead and to the next one. What's the most recent career goal you have accomplished?
This year I became a certified nurse, so you can get certifications in different areas of nursing. And so I studied and took the boards to be a certified peri-anesthesia nurse. So
Perfect.
That's my biggest.
All right, now let's get to that last question. When did you ever face a crisis at work?
Unfortunately, we do come across crises pretty frequently, because we are putting people under anesthesia, and they don't always wake up quickly enough, or Sometimes we have to intervene and give them medications to reverse the anesthesia. But most recently, the crisis we had was the patient's heart rate dropped really low. And so I had to see that on my monitors, assess my patient, call my anesthesiologist to get them there so that we could get orders for the correct medications, upgrade the patient's level of care, and get them safely to a unit that could handle the patient.
Yeah, so let's not worry about the crisis that Juju's going through or whenever that is, but let's just worry about this game that we're going to be playing. So let's test.
What are we going to play?
Let's test Nurse Julie on the Whisper Challenge.
The Whisper Challenge.
So I got a cool game for you. It's called
Alright.
the Whisper Challenge. So
Okay.
basically what you have to do is you have to put on these headphones, and they're noise canceling, so you can't really hear anything I'm saying. So
Okay.
all you have to do is just guess what I am speaking.
Okay. And will you give me a thumbs up if I get it right? And like a thumbs down if
Yeah.
I get it wrong?
And what if you get half of it right? Do I just do this?
Sure.
All right. So get those headphones on.
Okay. Let me turn them up.
All right.
Because I turned them down.
How do you feel about the music?
Okay.
How do you feel about the music? Just okay?
She can't hear you.
Oh, perfect. I like dogs.
Holocaust. Can you say it again?
I like dogs.
Alligator gauze.
I like dogs.
Alligator doll. Okay.
I like dogs.
Say it again.
I like dogs.
I like dogs.
Yes! You did it right at the time when that rap music was hearing. I just literally had to think. I had nothing, so I just had to do something random. So now it's my turn.
Okay.
I want to have a dance party. Alright, go.
French fries.
Black Forest Black.
French fries.
Vast or Trast.
French fries.
Wash, wash.
French fries.
Wax or crack.
You have to say actual words.
Watch out. Oh my gosh, I don't even know what you're saying.
French fries.
Fractured peaks.
No. French fries.
Let's go to beach for fraction's sake.
All right, 2 more tries. French fries.
Fractions for math.
French fries.
Can you just tell me the answer?
French fries.
Oh my gosh. That sounded nothing like I thought it was
Well,
a
you
mu-
can't hear it. You
I-
have to look at how I'm pronouncing
When
the
you said
word.
I thought you said 2 words, not 2 syllables.
Oh no, I
thought it
meant
was-
2 more
Yeah,
tries.
I had a feeling it was like different, had like more syllables than 2 because
Okay.
literally I wasn't really hearing. So
Okay.
that was a really hard game. So let's get back to the couch and let's go to some closing remarks.
Okay.
I feel like I was completely messed up with that game. It was definitely the hardest we've done. I know. I'm like, blah, blah, blah. And you're like alligator paws. Like, alligator paws honestly is not bad. I could easily said that, but it thing's a thing.
Yeah, it was fun. It was a good game.
So as a nurse, I feel like you have much better knowledge than me.
Oh, really? Well, I've been to school a lot longer than you.
Because
And I've been working a lot longer.
from that game I could tell. And I'm like, I don't even know what to even do. Because you never even said, I don't think you said French fries. I never would have said that. You probably just said it because I like that.
Oh, well, it was the first thing that came to my head.
I just really struggled to get things in my head, honestly. I just had to think of something random
Yeah.
and just...
Well, I like dogs was good.
Yeah, reminded me of Nebby, so I had to say it.
Yeah.
So, as a nurse, any last words you have to say?
It's a great field. You can do just about anything. If you don't like working at the hospital, you can work at a doctor's office. You can do online statistical type stuff. You can work as a school nurse. It's very versatile, and I encourage everybody to go because we always need nurses.
Yeah, absolutely.
There's a shortage.
Good impact in the world, honestly. Well, it was nice talking to you.
Nice talking to you too, Casey.
All right,
I appreciate it.
It was great to
Thanks
actually
for
have
having
you.
me on.
All right, so it is me, Kason Schrader, signing off. Remember, it's a great day in the Whatchamacallit Show. Good night. Come on, let's go.
Oh, I gotta be.
Yep.